Good afternoon and thanks for joining us for Living Local, your lifestyle show for everything Charleston. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're talking about women's health, specifically yearly OB/GYN screenings and what you need to know before you go.
Medical Monday, sponsored by East Cooper Medical Center.
Today we're talking about women's health, specifically when it comes to an OB/GYN annual visits. Tell me what an annual visit looks like. What should they expect?
We like to see young women early on before they become sexually active so that they become comfortable with us as their providers, so they feel open enough to share things with us that they may not want to share with their parents. And this allows us to develop a relationship with them so they trust us.
Because let's be honest, going to the doctor like this can be like, I mean, no offense, like the dentist, but I used to get anxiety.
Oh yes.
They would take
yes.
my blood pressure, it'd
Yes.
be through the roof.
Yes.
Because I mean, you're showing them your world, and especially if you're young, that's a lot.
It's very intimidating, yeah,
and
for
if
young
you're getting
girls.
them before they're sexually active, they're not, you know.
Yes, yes.
So
usually with these, the girls that are not sexually active yet, we don't do a full-on pelvic exam with those girls. But it just gives us an opportunity to discuss, you know, health concerns, issues coming up, just talk about their cycles and menstrual cramps. And then it is also a good time to start the HPV vaccine series if they haven't done that at their pediatrician's office.
Okay, and that's Gardasil, correct?
Yes.
Okay, tell us about that.
So Gardasil helps prevent some of those types of HPV virus that causes cervical cancer, anal cancer. It can cause genital warts. It's a 3-shot series, and we recommend young girls starting it before they become sexually active, before they are exposed to those strands of the virus. It is recommended for all women from the age of 9 to 26.
Oh, okay.
They also recommend that young boys get it as well.
Because they can get it, HPV, correct?
Yes, yes. It's a sexually transmitted virus, so it is passed from males to females and vice versa.
And sometimes you can carry it and have no clue that you have it, right?
That's exactly right.
As far as you say that you do them before they become sexually active, for the parents out there that aren't quite sure, should they just go with the moment that they start puberty? I mean, how should...
Yeah, I think that is a personal thing you have to decide as a parent, whether or not you want to be the one opening up that line of communication to talk about sexual activity, or if you want us to do it. That way the daughter doesn't have to feel uncomfortable with just talking to her mom or dad about her sexual activity. And then by bringing her to see us, we can develop a relationship with them, and hopefully they'll become more comfortable and confident in our care, that they'll feel like they could share that with us.
As far as screenings for cervical cancer, when do you start those?
Yeah, so we start those at the age of 21 is when we start doing pap smears to test for any abnormal cell changes on the cervix. And then from that point forward, you get a pap smear every 3 years. We still like to see you every year to talk about your health, do an exam, do a breast exam, make sure there's no abnormalities, listen to your heart and lungs. But we typically just do the pap smear every 3 years. And then once you reach the age of 30, we also do the pap smear, and we do a co-test with it to check for the HPV virus. And depending on the results, it depends on how frequently we may need to do the pap smears. But typically you only need a pap smear every 3 years unless you have an abnormal.
Oh, okay. As far as you talked about, screenings and breast cancer, so that's on a lot of people's mind. I mean, we hear stories all the time about people, especially at a young age too, that will get breast cancer. What do you recommend as far as when you start that screening process?
So we recommend in our clinic that we start screening at the age of 40. Different organizations recommend starting it and doing it differently. ACOG is the national standard that we follow, and which is every 1 to 2 years, starting at age 40. Depending on your risk factors, if you have a family history of breast cancer or a personal history of breast cancer, then we recommend starting the screening early. We like to have people, those that are higher risk, to fill out an assessment risk tool to see exactly when we should start doing those testings and screenings. We just recommend that everyone have breast self-awareness. So they don't recommend you doing breast exams every month now, but just be aware of what's normal and what's abnormal in your breast tissue so that you would know whenever something isn't always there that you can report it and you can come to us to be evaluated.
And that's why the annual screening or the annual appointment visit to your OBGYN is also because you'll do the breast exam.
Yeah, and kind of give them a baseline of saying, okay, everything feels normal, this is how it should feel at all times. So of course there can be changes during your cycle and there can be breast cysts that should typically go away after the cycle. But if anything is abnormal outside of that, then we definitely need to follow up and have an exam and send the patient for an ultrasound.
Okay, so what is the number one thing you see or problem for women when they come in?
I get a lot of new patients to our practice because I'm new with them, so I get new annuals that come in to talk about birth control and just do an annual exam with me. But a lot of the women come in for problems with bacterial vaginosis, yeast infections. They typically try to self-diagnose and treat with over-the-counter medicines, and it just never seems to work. So that's why it's important to come to us when you're having any kind of vaginal issues or irritation, itching, odor, for us to be able to examine you and give you the correct diagnosis.
So what are some of the things you could run into if you try to self-diagnose? I mean, you could make it a lot worse. You could have it for a lot longer.
Yeah, or you could be treating for a yeast infection when really it's a bacterial infection. And then the monostat over the counter is not going to treat a bacterial infection. And that's typically caused from an imbalance in the pH of the vagina. It's supposed to be more acidic, and whenever it becomes more alkaline, then it allows for bacteria to grow, and then that leads to discharge, odor, and it's not going to go away with just monostat. You need an antibiotic to take care of that.
So what are some of the things that we can do to prevent those types of infections?
So to keep yourself from not having a yeast infection, we recommend don't hang out in wet bathing suits all day. Don't
wear skinny jeans, yoga pants for 2 days.
Yeah, you want to allow your area to to breathe, because yeast likes to live in moist, warm, dark environments. So don't hang out in sweaty gym clothes or wet bathing suits. I recommend people taking a probiotic daily because it helps with the normal flora of the gut and the vagina, and it promotes that.
What about like body washes and stuff? Can those throw it off?
Yeah, I typically tell women just use water to wash your vagina, because anything can irritate and start a downward spiral there. Some women are really sensitive, so using soaps with fragrances can just lead on to more troublesome problems.
So let's talk about your annual exam. What's the checklist of the things that you're going to get during that?
So we have the patient fill out, an updated form to let us know if they've had any medical history, anything that's happened over the past year, anything new, any new surgeries, any new medications. And then once the patient gets in the room, we kind of go over those, discuss them, any issues that they may be having, complaints, we talk about those. And then we, of course, go on and do the physical exam, do a pelvic exam, breast exam. And then that's an important time also to talk about STD screening and ask the patient if she would like to be screened for STDs, and also have blood work drawn to test for HIV, syphilis, hepatitis. That's also important. They recommend women who are under the age of 25 to have yearly gonorrhea and chlamydia screenings who are at risky behavior.
So what would that be? What's risky behavior?
So girls who are having intercourse without protection, those are the ones that we consider to be participating in risky behavior, and they should have yearly screenings for STDs and HIV.
Alrighty, well thank you so much. I don't know about you at home, but I think we've learned a ton today, so we really appreciate you letting us come here at East Cooper and hang out.
Yeah, thanks. Thank you guys. You all have a great day.